NABL assessor, NABH blood bank assessor, so she has a long biodata to present, but in short, more than 10 years of experience of providing effective leadership as a lab director, lab head, and quality head. Skilled in overall lab administration, including lab setup, staff recruitment, staff training, budget, and financial planning, inventory, advisory services, SOP preparation, and implementation, growth of department by adding new technologies, total quality management, etc. So, ma'am, please go ahead with your presentation.
Respected chairpersons and all the delegates, first I would like to thank the management of Cancer Hospital and Research Institute for inviting me over here. So I'll be telling a little about NABH Guidelines for Infection Control Program. So what is NABH? NABH is National Accreditation Board for Hospitals and Healthcare Providers. Now this NABH, there is a book. So in the first presentation, somebody told that your hospital is NABH accredited according to the 5th edition. So you all should know what is NABH. It is National Accreditation Board for Hospitals and Healthcare Providers. Now this 5th edition book contains 10 chapters, and Hospital Infection Control is the chapter number 5. The Hospital Infection Control chapter contains 8 standards. So what are standards? NABH standards focus on patient safety and quality of the delivery of services by hospitals in the changing healthcare environment. Without being prescriptive, the objective elements remain informative and guide the organization in conducting its operations with focus on patient safety. Now, each NABH standard contains various objective elements. The objective elements are 4. Some are in core category, or in commitment category, or in achievement category, or in excellence category. Now these objective elements will help the healthcare organization in stepwise progression to mature quality system covering the full accreditation cycle. Now first we move on to Hospital Infection Control Standard 1. The organization has a comprehensive and coordinated hospital infection prevention and control program aimed at reducing or eliminating risks to patients, visitors, and providers of care and community. Now each standard, as I already told you, each standard contains various objective elements. Now first we move on to HIC 1A, which is a core element. The hospital infection prevention and control program should be documented with aims at preventing and reducing the risk of healthcare associated infections in the hospital. Now how you can implement this objective element? The hospital should have hospital infection control manual where all the infection control policies should be documented. HIC 1B, that states the hospital infection prevention and control program identifies high-risk activities and has written guidance to prevent and manage infections for these activities. Now, how you can implement this objective element? You should have high-risk areas and high-risk activities of your hospital identified, and it should be written in your hospital infection control manual. For example, in our hospital, we have identified the high-risk areas as ICUs, OT, isolation rooms, kitchen, CSSD, and drinking water facilities. There should be a separate action plan for audits and surveillance activities in these areas. Also, you should identify the high-risk activities, and the surveillance program should have various audits for auditing these high-risk activities. Now we move on to HIC 1C. It states that the infection prevention and control program is reviewed and updated at least once a year. To implement this, you should review your hospital infection control manual once in a year. So it should be reviewed and updated once in a year. HIC 1D states the infection prevention and control program is reviewed based on infection control assessment tool. Now there are various assessment tools of WHO and CDC which are available. So you can use any of the assessment tool for your hospital, but your infection control program should be based on the infection control risk assessment matrix that you should prepare in the January, and your manual should be based on that infection control risk. So commonly the assessors, they asked what is the ICRA. So that is the infection control risk assessment matrix, and your manual should be based on that infection control risk assessment matrix. Next is HIC 1E. The organization has a multidisciplinary infection control committee which coordinates all infection prevention and control activities. So as we had already discussed in the second lecture, there should be infection control committee which is multidisciplinary, and the meetings, you should hold the meeting monthly, and minutes of meeting should be documented after every meeting. HIC 1F states the organization has an infection control team which coordinates the implementation of all infection prevention and control activities. So you should have one infection control team which comprises of one infection control doctor, ICN, and you can have link nurses in various wards and ICUs that can also work as infection control team. HIC 1G states the organization has designated infection control officer as part of infection control team. 1H states that the organization has designated infection control nurse as part of infection control team. Now how to implement this objective element? Now you should have the job responsibilities and privileges of infection control officer and infection control nurse in the HIC manual and in your HR files. HIC 1I, the organization implements information, education and communication program for infection prevention and control activities for the community. To implement this, you can have training activities in the OPD and the IPD areas, and you can also implement this via various educational posters. Now very important in this objective element is that you should give the information, education and communication to the community also. So you should have certain training programs which are organized for the community, and you should have evidence with you which you can show to the assessors whenever they will ask for this particular objective element. HIC 1J states the organization participates in managing community outbreaks. So you should have outbreak policy, and all the notifiable diseases should be notified to the government agencies as required. Next we move on to standard 2, which states the organization provides adequate and appropriate resources for infection prevention and control. 2A, the management makes available resources required for infection control program. So what are the required resources? It can be PPE, hand rub, soap, disinfectants, enzymatic cleaners, biomedical waste, bags. HIC 2B states the organization earmarks adequate funds from its annual budget in this regard. So you should have the infection control budget with you, which includes all these resources. So the previous year budget and the next year budget, the projected budget, both should be there with you. HIC 2C states adequate and appropriate personal protective equipment, soaps and disinfectants are available and used correctly. HIC 2D states adequate and appropriate facilities for hand hygiene in all patient care areas are accessible to healthcare providers. So the hand hygiene facility should be there, both the hand wash and the hand rub facility. HIC 2E states that there should be isolation facilities available in the hospital. So what are the isolation facilities? Positive isolation facility, neutral and negative isolation facility for various transmission based precaution diseases. Next we move on to HIC 3 standard. The organization implements the infection prevention and control program in clinical areas. HIC 3A, the organization adheres to standard precautions at all times. 3B, the organization adheres to hand hygiene guidelines. HIC 3C, the organization adheres to transmission-based precautions. HIC 3D, the organization adheres to safe injection and infusion practices. How to implement these four objective elements? You should have training programs which should be on these standard precautions, hand hygiene guidelines, transmission-based precautions and safe injection and infusion practices for your staff, and also the standard operating procedures, how to implement this should also be written in the HIC manual. HIC 3E states that appropriate antimicrobial usage policy is established and documented. How to implement this objective element? You should have yearly antibiogram made by your microbiologist, and the antibiotic policy of the hospital should be based on this antibiogram. HIC 3F states the organization implements the antimicrobial usage policy and monitors the rational use of antimicrobial agents. Now, what is rational use of antimicrobial agents? You should have first the antibiogram, and your policy should be based on that particular antibiogram. The empirical usage of the antimicrobials should be based on the antibiotic policy. Also, you should identify the restricted antimicrobials in your hospital. You should have restricted antimicrobial usage form, which is also called as antibiotic justification form, and the pharmacy should only give antibiotic only and only if there is a justification form filled by the clinician, sent to the pharmacy, and only then that particular antibiotic can be given to the patient. And there should be monitoring of pre-surgical prophylaxis as per policy. The organization implements an antibiotic stewardship program. Now, this is a vast program which involves all these core elements. So, there should be infection prevention and control program at your hospital. You should control the source of infection, prescribe antibiotics only when they are truly needed, prescribe appropriate antibiotic with adequate dosage, using the shortest duration of antibiotics based on evidence, reassessing treatment where culture results are available, supporting surveillance of antimicrobial resistance and HAIs and monitoring of antibiotic consumption, educating your staff, and most important, supporting an interdisciplinary approach. Only one person cannot implement antibiotic stewardship program. It has to be a multidisciplinary approach to implement antibiotic stewardship program in the hospital. Now, HIC 4 standard states that the organization implements the infection prevention and control program in support services. HIC 4A is the organization has appropriate engineering controls to prevent infections. Now, what are these engineering controls? The patient care areas, in between two beds, there should be a distance of 1 to 2 meters. There should be OT surveillance cultures. There should be the maintenance schedule of AC plant, AC ducts, AHU cleaning, maintenance schedule of various plumbing activities and water supplies. Water testing should be done of RO and dialysis both, and ETP water analysis. HIC 4B states the organization designs and implements a plan to reduce the risk of infection during renovation and construction. So whenever there is a renovation and construction in the hospital, there should be an infection control risk assessment plan, and that should be assessed by the infection control nurse and the infection control officer. HIC 4C states that the organization adheres to housekeeping procedures. Now, how to implement this objective element? The hospital should have risk stratification matrix. So, you can divide your hospital into three various risk categories: the high risk, moderate risk, and low risk. High risk can include your OT, ICU, neonatal ICU, and CSSD, etc. The moderate risk can be the general wards, daycare, pharmacy, OPD, waiting room, and low risk can be the administrative areas. Now, what was the objective element? The objective element was the organization adheres to housekeeping procedures. Now, when you have divided your hospital into three different risk categories, you can divide the housekeeping procedure frequency. For example, in our hospital, we have divided, like, the high risk areas should be cleaned and carbolized 3 times in a day mandatorily. The moderate risk 2 times in a day, and low risk 1 time in a day. So that can be implemented. This standard element can be implemented like this. HIC 4D states, the HIC 4 standard is the organization implements the infection prevention and control program in support services. Now, what are these support services? The biomedical waste is handled appropriately and safely. So, you should segregate the biomedical waste. It should be collected in a color-coded bags with appropriate PPE. You should follow the Pollution Control Board guidelines, and yearly to visit to the agency collecting your common biomedical waste should be done by the infection control nurse. HIC 4E states the organization adheres to laundry and linen management processes. How to implement this? Handling linen in patient care units, there should be a proper standard operating procedure on this. During transport to laundry site, also you should have a SOP how to transport your laundry to the site where you are collecting the laundry. There should be a process to store and distribute the clean linen, and how to dispose of the linen. The standard operating procedure for disposal of linen should also be there. HIC 4F states the organization adheres to kitchen sanitation and food handling issues. Very important aspect. There should be routine investigation of food handlers. The food handlers should be vaccinated. The area hygiene of the kitchen should be maintained, and the storage of food should be looked into. The HIC 5 is the organization takes action to prevent healthcare associated infections in patients, that you have seen in the first lecture. So the organization takes action to prevent catheter associated urinary tract infections. The organization takes action to prevent infection related ventilator associated complication or pneumonia. The organization takes action to prevent catheter linked bloodstream infections. The organization takes action to prevent surgical site infections. Now, in your HIC manual, you should define what is a catheter associated urinary tract infection, how you are taking actions to prevent these infections. If this infection occurs, how you are doing the root cause analysis, and then how you are taking the corrective action and preventive action. So everything should be written in the HIC manual. Then we come to standard 6. The organization performs surveillance to capture and monitor infection prevention and control data. HIC 6A states the scope of surveillance incorporates tracking and analyzing of infection risks, rates, and trends. How to implement this? Now, 2 types of audits we are doing. One is the active audit and one is the passive surveillance audit. So active audit is the ICNs daily go to the various wards. That is the active audit she is doing. Passive surveillance is whenever you are taking the lab reports, whenever you are doing the post-discharge audit from the medical records, or whenever any surgical site infection or any other infection is reported by some physician or nurse, and then the ICN goes to that particular area and sees what is the root cause analysis, and then she performs the corrective and the preventive action. So both type of audits should be done by the hospital, And you should analyze the infection rates and trends. You should compare your infection rates and trends with the previous year also. HIC 6B states that there should be verification of data by the infection control team that can be done and discussed in the hospital infection control meeting. HIC 6C states that surveillance is directed towards identified high-risk activities, that I have already told you that you can identify various high-risk areas in your hospitals and you can plan various audits based on your high-risk areas identified. Surveillance includes monitoring the compliance with hand hygiene guidelines, the compliance rate of the hospital, area-wise and hospital-wise. Both should be calculated and it should be presented in the hospital infection control meeting. The sample size should include all categories of staff, including the consultants, the doctors, medical officers, nursing staff, and various GDAs and GDH. And you should use the WHO observation form for collecting this data. And most important, if you see that in HIC 6A it is written that you should track and analyze the infection control risks, rates and trends. These risk rates and trends of different areas should be there in the area itself, that what is the hand hygiene rate in the month of January, what is the hand hygiene rate in the month of February. The area should also know that how they are going in preventing the hospital infection control program. The E objective element states that there should be surveillance which include mechanism to capture the occurrence of multi-drug resistant organisms and highly virulent infections. So you should capture the data of MDROs, MRSA. So MDROs is multi-drug resistant organisms, methicillin resistant Staphylococcus aureus, and VRE, vancomycin resistant enterococci. Surveillance includes monitoring the effectiveness of housekeeping services. Now there should be a checklist of cleaning, but that should be monitored by the infection control nurse. And you should also capture the effectiveness of housekeeping activities by identifying various desired outcome parameters. HICG states that the feedback regarding the surveillance data is provided regularly to the healthcare provider. So the HAI rates, trends, these all should be displayed in the areas, or it can be displayed in the form of bulletin or newsletter of the hospital. The organization identifies and takes appropriate action to control outbreaks of infections. So there should be a written guidance for handling the outbreak. I suggest that surveillance data is analyzed and appropriate corrective and preventive actions are taken. So RCA and CAPA of each and every audit which is done by the infection control nurse should be done. HIC 7 standard states the infection prevention measures include